Going live. So welcome everyone to the March edition of the St. Luke's Climate and Health Learning Series. Today we have an exciting speaker, Alan Eber, the CEO of Eneration, and a climate and sustainability hero of mine. But before we get started with Alan, I want to remind everyone, please place your questions in the chat. We'll have Alan speak for about 45 minutes. And then I'll filter some questions and have a moderated discussion with Alan afterwards. So if you have questions about his presentation, please put them in the chat. And then we have two more talks in our spring series before we'll take a break for the summer. In April, Amanda Blanchette and Irene Ruiz will be talking about farm workers in Idaho and the direct health impacts we're seeing from extreme heat and smoke in our farm working community. And then in May, we will have a talk from about extreme heat and its impacts on vulnerable populations. That will be really exciting. So stay tuned for those. If you're having trouble getting on, please email us and let us know. We'll try to work on getting you a link that's working if you're having issues with your link. And with that being said, I want to introduce Alan Eber. Alan has 25 years of experience in HVAC design and healthcare facility leadership and played a key role in helping Gundersen Health System become the first energy independent health system in the nation, a change that has led Gundersen to save more than $6 million annually continuously. Throughout his tenure at Gundersen, he guided the transformation in various leadership roles, including serving as an energy manager, director of facilities, and the director of Envision. Alan holds a Bachelor of Science in Mechanical Engineering from the University of Wisconsin, an MBA, and a certified Six Sigma Black Belt. He has extensive experience leading multidisciplinary health teams and consulting with health systems on their energy sustainability journey. Alan currently also serves on the U.S. Department of Energy's Better Buildings Advisory Council for Healthcare and the Wisconsin Department of Safety and Professional Services Advisory Council for Building Sustainability. He's currently the CEO of Eneration, which is a name that blends energy and generation to reflect the company's core mission, inspired by the idea that Eneration's work begins on day one and creates a lasting impact for generations to come. It was founded with healthcare at its core, as every team member comes from healthcare, and the company exclusively serves healthcare organization with a mission to reduce the cost of care and improve the world around us by preventing up to 75 trillion BTUs of energy waste, which is a 10% reduction in healthcare energy consumption, and eliminate 5 million tons of CO2, which is the equivalent of removing 1.1 million cars from US roads. All of this would reduce cost of care in the US by $1 billion. So with these lofty goals and this great background, I want to introduce Alan Eber. Thanks for joining us today, Alan.
Thank you, Ethan, and it's great to be here. I love to talk to people that share the same mission and philosophies that I do. And I think we're going to have a really good conversation today. Now, I know Ethan just went over my entire bio, so I was going to give a little background on myself, and I still will a little bit. I'll probably expound some where Ethan didn't go. But so my background is I am an engineer. I spent 6 years getting a 4-year degree at UW-Madison here in Wisconsin, and then I came right back to La Crosse, where I grew up. And I worked for an HVAC company, and I did that for about 14 years, where I designed HVAC equipment, and then I managed a team of engineers. And then somewhere along the way, I decided to make the move over to healthcare. And when I came over to healthcare, I came there for, I like to have a purpose in everything that I do. And my purpose for moving over to healthcare was to help reduce the cost of healthcare. And, you know, I thought I was going to do it in one way. And after a number of years, I proved that we can do that, but it was in a totally different way than what I originally thought that we were going to do it in. And we did that through the energy sustainability initiatives. So as Ethan said, I worked at a healthcare system, Gundersen Health System. We're going to talk a lot about that today. Did that for about 14 years again. It turns out every 14 years I need to go get a new career as it turns out in my life. So I did that for about 14 years. And then recently, last summer, we spun a business off called Eneration. And we're going to talk a little about that as well and what we're doing and what we're trying to do that. So today, what I wanted to do was talk about my experience in healthcare. You know, not only was I an energy manager in healthcare and implemented a lot of the things that we're going to talk about, but I turned into the facility director. So I had the good fortune of having to live with the things that we implemented for a long time. I did that for about 6 or 7 years, living with everything that we did. So, it's not like we implemented them and then walked away. We actually lived with it and made improvements on them over those last 7 years that I was the facility director. And when I was the director of facilities, it was we did maintenance, I did construction, real estate, security, environment of care, a number of different everything that they could throw at me that nobody else wanted. I think they threw at me. So I had a lot of experience in healthcare and some leadership roles. So we're going to talk about my time there. Then we're going to turn around and we've done a lot of research on where is healthcare, where is the industry as it turns into sustainable energy. So I'm going to share where that industry is, where we are as a healthcare organization or industry, and then talk about what can be done moving forward from now. So having said all of that, let's get started. But even before we do that, I just want to bring this up because you're going to see this time and time again through this discussion. There's a couple of things, a couple of takeaways on the slide. Number one, I told you we did a lot of research before we started this business generation. We went through and did a research, and we talked to over 100 different healthcare organizations to try to see where were they in their evolution of energy and sustainability, and what were they really looking for. So as we did that, we came up with a path here of different levels, we call it the evolution of sustainability in healthcare. And there's goes everywhere from 1 all the way to 5. And when we were at the 1 stage, what we're really talking about is these people haven't done hardly anything. They think energy is the cost of saving lives. Haven't really looked forward to do anything. Just haven't really gotten started. Then the next stage is in the cost-driven stage where they've done some things and they're starting to see some financial improvements. And then you can move down 3, 4, and 5, and you can see how what their motivations are for doing this work changes as they evolve through that scale. The other thing I wanted to point out on this was the Lean Six Sigma. I myself, as you saw in the Six Sigma black belt, we've got another person on our team that is a master black belt. He taught Lean Six Sigma methodologies all over the world. And this is how we have been able to be successful using these types of processes. This isn't, we weren't successful because we knew more about energy than anybody else. We were successful because we used a methodology to achieve what we wanted to achieve. So that's what I wanted you to get on the slide, and we're gonna refer back to this, and you will see this as we talk about how all of this fits in with what we did at Gundersen and what we're doing now. So this is when we started at Gundersen. I'll tell you, and I think it sounds like maybe Dr. Thompson is going to be talking to some of you in the next couple of months. It'll be interesting to see how what I say and what he says differs, if there are differences. But to get started, we were in the process of building a new hospital, building a massive expansion on the existing hospital at Gundersen Health System. And the CEO, Dr. Thompson, came to us and said, "Hey, is there any chance we could make that an energy independent building?" So a group of us engineers got together and said, "Yeah, we can do that. And in fact, we think it's possible to make the entire health system energy independent." And he said, "That's great, go do it." So we said, "All right, how in the world are we going to go do this massive endeavor now?" So when you talk about achieving anything that you're trying to accomplish in life, the very first step is to begin with the end in mind. Covey says that in his book, 7 Habits. You always begin with the end in mind. Where do you want to get to? And then figure out how you're going to get there. So that's exactly what we did here. We said, all right, we're going to be energy independent. Let's go figure out what that really means. So we put some definitions behind that, which means we would produce as much power using clean, renewable resources as we use from fossil fuels. So that was our definition of energy independence. And then we set a target on it. We said, by 2014, we will be energy independent. So this wasn't, we look at a lot of these goals that are out there now where people say by 2050, I want to have reduced our energy use by 30% or something. By 2050, half the people in the organization aren't even going to be there anymore. So, we said if we're going to do something, we need to put a goal on there that will actually have some sticktiveness, if that's a real word, that will actually stick and we can carry through with that goal. So that's why we put this time bound on it. We set a definition out and we said, all right, now let's go get started on this goal. The other thing about this goal, and you'll hear me talk about this quite a bit in this presentation, is this is a big, hairy, audacious goal. Now, I don't know if you haven't read Jim Collins' book, Built to Last, I suggest you do it. It's one of the better business books I've ever read. But in there, he talks about a BHAG, a big, hairy, audacious goal. and what does it mean to do it, and what kind of actions does that drive out of the team and out of the organization that these big, hairy, audacious goals are being strived for in there. And you'll see that as we go forward, and I'll talk about it a few more times. All right. On the next slide. Oh, getting some background for those of you who don't know who Gundersen is. It's a non-for-profit organization. It's in a tri-state area: Wisconsin, Minnesota, and Iowa. It is a physician-led, or at the time, it was a physician-led organization. Our CEO was a physician. The board of directors had physician representations on it. So, we really were the physician-led organization. We were centered in La Crosse. Our main campus was in La Crosse. It was a 325 tertiary bed medical center. At that time, we had about 7,000 employees, about 500 medical staff, in 40 clinics in this tri-state area. So, at the end of the day, it was about $1 billion organization. So again, the size of the organization is important to what we talk about, because it wasn't such a huge organization that you couldn't get things done in, and it wasn't such a small organization that it didn't have the resources to do a lot of things. So, it was a really nice size organization to be able to achieve these big, hairy, audacious goals that we're going to talk about. It also has a medical foundation, so it with a residency, and they do have this area's only children's miracle network. So that's just a little background on the size of Gundersen. It's important just to have a grasp of how big of a system are we talking about. Total, when we started, it was about 2.5 million square feet. When we ended, it was about 3.6 million square feet, and I'll talk about that more later too. So the next question, and the question that my guess is you are asking yourselves, and if not, should be, is why would a healthcare organization strive to do something like this? This takes resources, both in the time of people's time. It takes capital resources to do this. It takes political resources to do this, making sure that the staff and the board of directors are behind this. So there's a lot of effort that goes into doing something that people typically would say, this doesn't really fit healthcare. Healthcare's mission is to make people healthy that are sick. Well, if you take a step back, that's not the mission of healthcare, and this does fit with healthcare very well. So when we took a look at why we want to do this, we came up with 3 different things. The first thing is, the pollutants from all the fossil fuels that we are burning, they cause disease. They cause liver cancer, kidney, asthma, as we were talking about. Lots of different diseases are being caused from just the operations of healthcare. Well, that certainly doesn't live the mission of healthcare. The second thing that we saw as we were getting started is energy costs continue to climb. On average, energy costs go up about 2.5% to 3% year over year. And if we use the same amount of energy, that's a pretty big burden on the financials of a healthcare organization. And then the third thing we saw was hospitals are some of the worst offenders. Hospitals typically use about 2.5 times the energy of a typical office building does. So when you look at all of those things, we came back and said, well, if we look at our purpose statement, and back then, Gundersen's purpose statement was to bring health and well-being to our patients and communities. And you look at what we were doing and how we were emitting these fossil fuels, how our costs were increasing year over year, that certainly does not live the purpose of what this mission is. And we said, if we're going to do something about it, we have to do this. This isn't a nice to do. If we truly believe what we're in the business to do, this is something we need to do. And then here's another chart. I told you I came over to healthcare to help reduce the cost of healthcare. I always put over here, what is our cost of healthcare in the United States? And this is a chart that I think it's fairly up to date within a couple of years, that shows what is the cost per capita of healthcare, of providing healthcare to every person in that country. So in the United States, it's about $12,000, $12,500 to provide care for every person in the country. The average for developed countries is roughly about $6,000. So we spend twice the money to take care of the patients in the United States that the average country does that's developed. So, anything we can do to lower the cost of healthcare is a huge advantage. And that's a big driver for what I try to do here, as well as improving the health of the world around us. The last little pie chart over here is this 5%. Healthcare uses about 5% of the total energy in the United States. When you take a look at the carbon dioxide emission from healthcare, people say it's between 8.5% to 10% of all of the carbon dioxide emitted in the United States is emitted from the actions of healthcare. If the United States healthcare was a country, it would be the 5th largest emitter of carbon dioxide in the world. So again, what is the mission of these organizations, and are we living the mission? And if not, let's go do something about it. And that's what we said when we were at Gundersen. Let's go do something about this. So now we have a goal. Now we have a reason for why we want to achieve that goal. So the next step is to define or to measure and analyze, right? We've already defined what we want to do. If you look at this DMAIC process, now we're going to measure and analyze where are we going to go? So the first thing that we have to do is figure out, all right, where are we today? What is our baseline? How much energy are we using? And where does that stand with others in that, are we better than most? Are we worse than most? How do we compare with other healthcare systems so we can get a flavor for, where should we be focusing? So we did our baselining, we did our benchmarking, and then we said, okay, if we're going to get to energy independence, that means we have to offset 100% of our energy consumption. So we went forward and created a series of projects. This is just a very high level look at it. But these were all the projects that we needed to do to get to ourselves to be energy independent. Now I can tell you over the 6 years that we worked on this, this was not a static map. This map probably changed every 6 months when we learned something new, when we saw an opportunity we hadn't seen before, when something didn't pan out like we might have thought it did. This was a very liquid map to get to where we wanted to go. But at least we always had a map in front of us. We always knew what are the next steps? What is the timing we need to do to achieve this goal by 2014, which is what we set out to do. So this was a critical step in being able to achieve this. And again, this falls back into that DMAIC process, that Six Sigma lean methodology. Without that, we wouldn't have had this map moving forward to guide us, and without the flexibility to change it as we move forward. So I showed you the map on a number of different things. We're going to spend a little time on this slide because this is the good stuff. So when we talk about how to move forward in health systems, to start down this path, we get a lot of health systems that come and talk to us, and they say, hey, we want to put some solar up here. Can you help us do this? And the first question we ask them is, all right, what's your baseline and benchmark on your energy usage? Are you below benchmark? Are you at benchmark? Where do you stand? I'd say 7 times out of 10, they can't tell us where they are. They haven't baselined or benchmarked themselves. So we say, all right, before you even think about doing renewables, let's stop wasting energy first, because wasting energy is, why use it if you don't need it? And the paybacks on this energy conservation are way better than they are with any kind of renewable generation. So that's where we try to guide people. And at Gundersen, those are the first things that we did. We went and did a energy analysis inside of our facilities, and we were able to identify 35% savings just by changing the way we were running our buildings and putting in new capital projects. In fact, when we really dove into it, we were able to save about 15% of our energy usage with no capital infusion, just by changing the way we operated our buildings, just by changing how we were controlling things. We were able to save 15% over our total energy. And at that time, Gundersen was spending about $5 million in energy. So these are real numbers we're talking about saving. And when you're not talking about capital infusion, what CFO would say, hey, let's not do that. So we did that. And then the next thing that we did on energy conservation after we changed the way we were running is we looked for opportunities for replacements. We had a very old chiller system that was, part of it was in dire need of work because it was about to fail, but all of it was horribly inefficient. So we said, here's some equipment that's going to leave us hanging someday anyway. Let's do a really good job of replacing this expensive equipment and doing it extremely efficiently. So we looked for opportunities to say, here's something that's inefficient that we know we're going to have to replace in the next couple of years. Let's do this now, and so we can keep walking down our path. The other thing we did is say, okay, there's always opportunities for heating and cooling simultaneously in healthcare buildings. So we found opportunities to be able to reuse the heat that we were already putting in the building. We did this through a series of heat pump systems. So, some pretty nifty HVAC systems that we were able to put in just to capture the energy that was already there, and reusing it. So we started with the stuff that was really easy to do, inexpensive. Once we started seeing some improvements and saving money, then we turned into, all right, let's start doing some capital investment so that we can conserve more energy in our existing facilities. Now, That's great, and we always preach that first. But if you're going to achieve energy independence, you certainly can't do that by conservation. Hospital operations are energy intensive, so you can't do that. You can't just conserve your way to zero. So we said, all right, let's go. We need to find ways to generate power and do it in a clean, renewable fashion. So when we first started this endeavor, we said, all right, you know what we're going to do? We're going to just put up a giant wind farm and be done. That's all we need to do. So let's go and put up a bunch of windmills and call it a day. So we looked into doing that. And as it turns out, if you generate more than 5 megawatts, the utilities, especially in the Wisconsin area, are very conservative. And they say, well, if you do that, you are now a major manufacturer of electricity and you need to put in your own substation. So that added a many millions of dollars onto the project to do that. So we said, okay, well, that doesn't justify us doing this. So let's change our thought process. Again, we just changed our map by what we thought and what we learned. So instead of putting up one giant wind farm that was going to be about 20 megawatts, we put up two separate wind farms. One of them was just under 5 megawatts, and the other one was just under 5 megawatts. So we learned really quickly how to play these games with utilities. The other thing that we did is we looked for opportunities around us where we could partner with other entities, and we saw energy ways. So, once you start getting into this mindset, once you create these BHAGs, and Jim Collins talks about this, you see things differently. So we were driving by the county landfill where they had a big flame coming out of the county landfill. And we said, all right, there's obviously a lot of energy there. What's going on? And is there any way we can use that? So we went over and we talked to the county landfill and said, what's going on here? And is there a way we can partner? So the county landfill said, well, obviously this is methane burning off. When you close up a landfill, it creates methane and you need to flare that so it doesn't harm the atmosphere. So we said, okay, well, we know something about methane. We can put that in an engine and we can make power out of that engine. So we said, we gave them two different options. We said, number one, we want to do this. We want to take your methane. We want to bring it over to our campus, which is about a mile away from the landfill. And when we do that, we're just going to take your methane and we're going to burn it, and we're going to put it in an internal combustion engine. We're going to make electricity, and we're also going to make heat out of that. And we're going to heat our buildings with this engine. Or, county landfill, if you want to, you put up the capital for your end of this, which is capturing the methane, cleaning it, compressing it, and piping it, and then pumping it to us. And if you do that, we will actually pay you for the methane that you use. So this was a very forward-thinking landfill. They always have been. And they said, you know what, we're going to take that on ourselves. We're going to own and operate that. And then you pay us for the methane that we provide to you. And we said, that sounds great. Let's do that. So now we are paying the county landfill about 15 cents on the dollar for the energy that we get from what we would have off of natural gas. And that money goes directly back into the community. All the taxpayers in the county that we live in have to pay for this landfill. So now that they have an income, it reduces their expenses. Their profits are not quite as negative as they were before. So we just took money that we were sending to, wherever we get our natural gas, and now we're putting that money right back into our community, which is a benefit that we never even thought of before we started this. But that's the benefit of these partnerships. So we did that. We've done at Gundersen, they did about 3.5 megawatts of solar. The first solar that Gundersen did was well before 2008. And the paybacks on that were horrible. I think there were about 22 years for that product to pay back. Now we're seeing paybacks less than 12 years. And if you include the Inflation Reduction Act, we're seeing paybacks down around 8 years with solar, which is, some people might say that's a long time payback, but when that equipment is guaranteed for 25 years, those paybacks aren't very long at all. The other thing that we did is we looked to say, where is most of the energy going for Gundersen? And even to this day, the most energy at Gundersen is being used generating steam to heat the campus in downtown La Crosse. It's about, that campus now is about 2.5 million square feet. So we said, we got to find a way to generate that steam, not using fossil fuels. So we put in a biomass boiler in which we burn wood to make that steam to heat the entire campus. We also, that's a bi-generation machine or a cogeneration machine. Not only do we make steam, to heat the campus, but we make electricity from the steam to power that campus. So we put about 500 kilowatts of power back into that campus through a steam turbine generator. So it's a cogeneration system. Now, this is an extremely clean burning system. We have in there two forms of particulate removal systems. There's a multi-cyclone, and then at the end of it, there's an ESP, which when we do our stack testing, the emissions out of this, as far as particulate goes, are just as low as it is out of our natural gas boilers. And obviously carbon dioxide, there's zero carbon dioxide that's generated from these systems because the trees have already captured that. So there's no new carbon dioxide being generated into the air. So it's a really good project. And what I love about this project as well is, again, it's this partner thing. You know, we would have been spending this money on natural gas that ships outside of our state. Now, all of the fuel that we get from this goes directly into people that live within a 50-mile radius of this facility. Most of these people get their health care from Gundersen. So now we're giving back to the people that get their care from us. On top of that, we've done a number of other renewable generations. You look for what you have around you. And in Wisconsin, we have a lot of cows around us. So we look to the cows to see if we could generate power. And obviously, cows generate a lot of methane too. And we learned over the years how to generate power from methane. So we partnered with a couple of large farmers around this area and created lagoons that generate methane. And then we made electricity off of that methane. And then we also, every new building that we build, we put in geothermal. So geothermal is a system where in the summertime, you take the heat from the building, you put it down into the earth, you exchange it, you cool that down, you cool the water that you put down there back, and then you bring it back to the building colder. In the summertime, you do the exact opposite. You take the cold water, you throw it into the earth, you bring it back warmer. So you're basically using the earth as a thermal battery. So you can put it out there in the summer and then take it back in the winter. So these were all the things that we did on the energy conservation and then on the renewable generation side. But the other thing that was going on is this wasn't the only thing Gundersen was working on during those times. We were growing and growing dramatically. I said we were about a $1 billion organization. I don't know how big Gundersen is anymore, but I know they're over 1.5 billion. So growing quite a bit. And as they grow, we added a lot of square footage, a lot of facility space. So we said, if we're going to achieve this energy independence goal, the more building we build, the harder it is going to be for us to get there. If you go back to that chart, the roadmap chart, you saw a big dip down. That big dip down was a 430,000 square foot addition onto our hospital. So we said, all right, if we're going to do this, we need to make this handicap as small as possible. So we got really good at designing and constructing radically efficient buildings. Now, when I say radically efficient, every building that Gundersen has designed, built, and operated over the last, call it 10 years, has used 50% of the energy that a typical building in our region would have used. 2 of those are net zero buildings with no natural gas hookups at all, totally electric buildings. And this was, well before electrifying buildings was a popular thing to do. So we learned how to do this extremely well. And what I love about this, when you talk about energy initiatives and sustainable energy, is it gives you a clean sheet of paper. Once upon a time, I was a design engineer, so I designed things from scratch. And what I learned is, you have all of these opportunities in front of you to do things when you design it from scratch instead of taking something that's existing and how can you tweak it. So I put this seesaw down there. It's something that I stole back from my old days being an engineer. The earlier you are in a process, the more leverage you have over the outcome of it. So when you're in a concept phase, you have a lot of leverage for how much you can affect the efficiencies. As you get through the design phase, you still have a lot of leverage, but a little bit more. And then as you move closer and closer to operations, your leverage gets less. So you can still do things, but you can't have quite as much effect. So that's why I love this construction, because you can have massive effects. Taking an existing building, making it net zero is very difficult to do. New construction, making net zero, that is doable. The other half of this is as you move closer to operations, it costs more and more money to make these changes. And the concept phase is, it's just the time to come up with ideas, dream ideas. So that's why I really like this phase. Now, through all of this, we have to remember that we are healthcare. And in healthcare, job number one is taking care of patients. So when we started talking about this, there was a lot of pushback inside of the healthcare organization saying, why are we spending time doing this and not spending time taking care of our patients? So this took a lot of change management within the organization. And a big part of that change management was showing success along the way, sharing that with staff, sharing that internally and externally along the way. So when I talked about these very low cost initiatives that we did right away, as soon as we started seeing results, first thing we do is we turn that around and say, hey, we made these changes inside of our organization and look at the effect it's having. We're saving this much money in the organization as a result, and our emissions have been reduced as this. So once you start getting people to see that and understand it, naturally they say, hey, that's great. How do we do a little more? So then we talk about it. Every time we did something, we made a big deal about it, talk to our staff. And that's how we got the change management to get really excited about what we were doing. I'll have a slide here that talks about that later on. All right. Oh, we fall back on this DMAIC process, the define, measure, analyze, improve, and control. So we've done a lot of this work. We've gotten ourselves to energy independence in 2014, but we weren't done. So the last step in this process is to control it. Now, we've done a lot of work over the years. We've worked with a lot of different health systems. There's been some studies done. Texas A&M did a study on this. They called it efficiency erosion. And we see this just about everywhere we go, this efficiency erosion. And that's this black line on top of this chart. So this is where this is the efficiency of a building or of a building over time. When we looked at the Gundersen facilities before we started doing anything, we saw an increase in just the amount of energy those facilities use by about 3% year over year. In some cases, it was up to about 5% year over year. And this wasn't a 1 or 2 year trend. This was a 5 year trend where we're seeing increases in energy by that amount. And there's all kinds of reasons why that happens. But if you're not actively working on this erosion just creeps in and it just naturally happens. I'm not going to go into all the reasons why that's there, but we know a lot of those reasons. So we said, we've done all of this work. We're saving all of this money. We know if we don't continue to watch this, it will erode and we will lose a lot of the gains that we've achieved. You can see this chart and how this is the efficiency. So it's called an EUI. It's called an energy use intensity. It's a way to measure how much energy a building's using per square footage. So you can baseline and benchmark compared to other facilities. And the lower you go, the better the efficiencies of the buildings are. And this is a conglomerate of all the health of Gundersen's facilities and where their EUI was. And you can see back in 2014 and 2015, we still started making improvements. And then we had 1 year where we fell back a little bit. And then we said, we got to get on this erosion control. So we put some processes into place and we started slowly creeping down again. And what we did for control is number one, you have to measure. You have to understand where are you, what are the trends that you're seeing. And this is back when I was the director of facilities at Gundersen. And I had a team of people and I told them every day, you're going to go look at how much energy the facilities you're responsible are for use. And I've got it's a really neat story of something that happened. One day, a supervisor came to me and said, "Hey, there is something going on in this facility. The last 2 days it was using 20% more energy than it was the 2 days before." And we said, "Oh my gosh, well, let's go take a look at that." So we dug into a little bit and we found out that it was about a 250,000 square foot clinic, and there are two air handlers that serve it. And one of the air handlers, instead of scheduling where it would turn down at night, that schedule for some reason fell off. So the air handler was running it was running 24 hours a day, all day long. And if we wouldn't have caught that when we did, that one piece of equipment would have cost us $20,000 a month. So by this individual looking at that on an everyday basis, saved us probably $30,000 because there's no way we would have seen that just looking at utility bills until about a month and a half after the problem actually started. So when I talk about measure and control, these are the things that you have to do to continually combat this erosion that shows up. All right. So we set out to hit this energy independence target. And we did that for two reasons. We did that, number one, is because we wanted to reduce our harmful emissions. And we did that, number two, because we wanted to reduce the cost. And we achieved both of those. What you see here is our harmful emissions were reduced by 80%. And our annual cost avoidance right now, Gundersen's reducing over $6 million a year. And this is every year they see those benefits. And that 80% reduction in harmful emissions, that does not include we were 2.5 million square feet when we started. Today, they're 3.6 million square feet. Their harmful emissions are still reduced by 80% of what they were back in 2008. So even with that massive growth, they're still reducing the harmful emissions. The next thing I wanted, those are the two things we set out to do, but there were some other things that happened that we didn't know were going to happen as a result of this. One was some of the partnerships that I talked about with some local entities and some, instead of funds leaving our area, funds staying in our area, building these partnerships. The other thing that happened was our staff engagement went through the roof. Our staff started talking about this and bragging about it to other people. They really felt good. As a facility director and energy manager, I'd have staff come up to me all the time saying, "Hey, this is great. How can I be a part of this? What can I do to help us move forward in these initiatives?" And Dr. Dolan, who was our chief medical officer, came to us and said, "Do you know that we are having physicians come to Gundersen, interview with Gundersen solely because of what they've heard us do on the Sustainable Energy Initiative?" Now, I'm sure I don't need to tell this group of people how difficult it is to hire doctors. So when you have people coming to you because of what they hear you do in sustainable, this is a huge benefit to the organization. And the last thing is, we weren't afraid to brag about this and talk to people about it for two reasons. One, we wanted to get it's the change management. We want people to understand what we're doing and why we're doing it. And as we did that, people started to take notice. We were the only healthcare system that was invited to the Paris Council. We were awarded the Champions of Change by the White House. These things would not have happened, and we didn't expect them to happen. But as part of what Jim Collins talks about when he talks about BHAGs, opportunities are going to present to you that you didn't know were there when you do these types of things. And the last thing I wanted to talk about on this slide was this chart. I don't want to get into it in too much detail, but this chart shows this green line is the actual utility spend that Gundersen had from 2008 to 2022. And when you look at it, you say, "My gosh, that's pretty flat. You're telling me you saved a lot of money, but look at how flat that spend is year over year." So this is where you need to turn back to your CFO and says, "Sure, Mr. and Mrs. CFO, but this blue line is what we would have spent if we had done nothing." Remember, I talked about the cost of utilities going up at about a 3% year over year. The other thing is the organization grew dramatically over that time frame, 2.5 million square feet to 3.6 million square feet. And we were able to keep the spend the same throughout all of that growth, throughout all of that inflation. So when you start sharing these kinds of values, people start to take notice. Okay. The other thing that happened through all of this, I said these BHAGs create opportunities that you didn't know were there, is we had the opportunity for other healthcare systems to come to us and say, "Hey, you guys are doing something amazing. Can you help us do some of this?" And, for about a decade, maybe a little over a decade now, we would go and help other healthcare systems start to move forward. And when we first started, we did it because we believed in what we were doing. We were helping to lower the cost. We were helping to reduce harmful emissions. This is what our purpose is. So we said, let's go help these people do it. But after about a year or two, we found out, what, this is a lot of work to do this. Our patients are paying us money to come help these other healthcare systems. That's not right. So we actually started charging these healthcare systems to do this. And we basically just covered our costs for a number of times. And this was a side job for us. So we did that for, almost 10 years that we'd go and help some systems out. But then, the pandemic came, COVID came, and nobody called us anymore. Which is good because we didn't have any time to help anybody anymore. So we just put that all on the back burner. But once the pandemic came under control again, we said we had more people come and say, "Hey, now we're ready to get started. Can you come and help us?" And this is when we said, "You know what? Maybe there is an opportunity for us to do something more than we were doing." We've helped Gundersen move forward with these initiatives. We've made great results. But if we're going to continue this mission, it's time for us to not just do it within one healthcare system. Let's help other healthcare systems move forward. And that's where we came up with this 75 trillion BTU goal. And what that means is, it's how much energy we're going to help healthcare systems eliminate. And by doing that, we're going to save $1 billion and reduce the CO2 emissions by 5 million tons a year. So we said, we can't do that within Gundersen. We need to break away from Gundersen and do that. And this is the team that we're doing it with. Most of these people were part of all of the work that we did at Gundersen throughout the time that we were doing that. So I take this back, and what we've done with this organization that's called Eneration is we went out, we did a lot of research. Obviously, we knew a lot of what was going on. What are the problems in healthcare? Low margins, staff retention, but execution was another area that was a problem for healthcare. And the more we talk to people, the more we understand that they're having a real hard time executing and getting things done. So we said, how are we going to solve these problems inside of healthcare? And we went back to our energy and sustainability scale and say, okay, not everybody's in the same place. Not everything we do is going to work depending on where they are. So let's focus on where the most people are. And the most people, as we've learned through our research, are back at this area where they've done a few things maybe, or some people haven't even started. So we see a lot of people back in this area and not as many people out in the further evolution scale. So we went and we created a number of products to meet people where they are. The first thing that we have to do is we have to get the data. I talked about baselining and benchmarking to measure where you are. So we have a product where we can help health systems understand where are you, where is your baseline, where is your benchmark, and then continually measure their energy usage over time. So we have a product called InView that does that. We have a product called Instruct. We learned really well how to build new buildings efficiently and operate them. So we have a product that helps people do that. We learned how to set targets, and not only set the targets, but if you can set a target, but if it doesn't align with the mission and the goals or the strategy of the organization, it's easy for people to push that to the side and say, no, you know what, we're going to stop doing that because we've got these other things to focus on. So when you set goals and targets that align with the strategy and the mission of the organization, you have to argue against doing it, not to do it. So that's what we try to do when we help organizations set targets for themselves. And then we have this Encompass product, which we'll build a roadmap for them and help them walk that roadmap so that they can achieve their goals, just like we did at Gundersen. Here's your roadmap. Now let's walk down that roadmap so that we can achieve the goals you set out. In the one that we're really excited about, and it's taking on pretty well, is this Engage, and I'm going to talk about that next. Remember on that chart I showed you where most people are, they haven't started or they've just done a few things. Well, we created a model that fits really well with those folks. And what we do is we will work with a healthcare system and say, if you give us your utility data, we will just do your baseline and benchmark for you. That's all you have to do. Give us 3 years worth of data. We'll come back to you. We'll tell you where do you stand and how does it compare against others in your region. And from that, we can tell you if there's opportunities or not. And if there's no opportunities, we'll say, hey, this is great. You guys are doing a good job. Keep up the good work. If it looks like there is opportunities, that's when we want to come on site, visit with your people, walk your facilities and say, hey, does this look like, I want to make sure that what we're seeing in the utility data is actually what we think we're seeing. And once we do that and say, okay, you guys have opportunities here. This is that low cost, no cost implementation phase. We think you have opportunities here. We're going to come on site. We're going to look again in real great detail. We're going to find these opportunities, and then we're going to implement them for you. Execution is a problem. We want to take that off your plate. We know your team is doing lots of other things. We will help you execute these initiatives. And then at the end of it, we're going to work with you for 30 months to make sure that those savings are maintained. And with all of this, you never pay us a dime until you save money. And we will show you your savings using your utility bills. This isn't what we project savings to be. This is what they actually are. And we take a share of that and you keep a share of that. So these healthcare systems that engage with us, they never pay more than they would have if they hadn't engaged with us. They always pay less. And then we just take a share of those savings. So this is something that we're really excited about. We're working with a number of clients on this right now with great success. And this last slide that I have here is, why? Why are we doing this now? As Eneration, we're doing this now because it was time for us to have a greater effect on the world than we were having before. But also the impetus is out there in everywhere that we look. There's a number of things going on. I don't know, a lot of people are governed by the Joint Commission, or they come and have the Joint Commission do all of their inspections. The Joint Commission has moved forward with creating, they originally tried to create a stick instead of a carrot, where they said, we're going to create this sustainability initiative and you have to follow it or there will be repercussions. The healthcare systems came back and said, no, you don't dare do that. And they said, okay, we'll leave you go for now. But they did come forward and they have a optional certificate. So if you go forward and do this path that they're laying out, you can get a certificate from the Joint Commission in sustainability. I can also tell you, I've talked with CMS and they are starting down a road like this a little bit too. So there is some talk about these authorities having jurisdiction coming in and having some say on how sustainability works in healthcare. The Inflation Reduction Act that came out in 2022, for a long time, non-for-profit healthcare organizations could not take advantage of the tax incentives that were out to move forward with renewable energy. That changed with the Inflation Reduction Act. Now there's a path forward for non-for-profits to get these tax incentives that have been there for many, many years. There's ways that they can get these. It's called a direct pay. So instead of the tax reduction, which healthcare systems don't get, it's a direct pay from the federal government to move forward with the renewable energy initiatives. Healthcare Without Harm is an organization solely dedicated on sustainability in healthcare. They have all kinds of contests. Energy to Care is it's the American Society of Healthcare Engineers, which is a subset of the American Healthcare Association. They have all kinds of competitions and ways to help healthcare systems move forward. And then there was the White House Challenge, the Carbon Challenge for Healthcare, that I think last I saw about 250 health systems signed up for a carbon reduction goal for 2030 and for 2050. So all of these things are out there. And on top of all of this, since the pandemic came and left, margins in healthcare have dwindled. So, we are talking to more CFOs now that are looking for any opportunity they can to help improve their margins. When we talk about margins, say we can save $100,000 in energy for a healthcare system. When you talk about a 4% margin in a healthcare system, to have that same kind of effect on margin improvement, you would have to generate $2.5 million in revenue. So I'm going to say that again. With a 4% margin, if we can save $100,000 out of expense to have that same benefit margin, it's a $2.5 million revenue that you will have to bring in, because you only get 4% of that revenue that you bring in. So it has a huge lever when you talk about margin improvement. Anything you can do to reduce costs. The other beautiful thing about these sustainable energy and reducing costs is nobody knows you've done it. It's all in the background. It doesn't change the way anybody has to provide care to patients. It's all done in the background. And there are very few things I can think of in healthcare where you can say that about reducing your energy and not changing the way that you provide healthcare. And then obviously there's the climate change aspect of this. This is a statement that the World Health Organization put out, how they are expecting costs to increase because of global warming by $2 to $3 billion per year in 2030. 250,000 additional deaths per year from what the effects of global warming is. Now, these are projections right now. There's no hard data on this, but I think it's not hard to see global warming is going to have effects, and it is going to have effects on healthcare. So as a healthcare industry, we should be doing something about it, because if we don't do something about it, it's just going to hurt us down the road. And with that, I believe I will be done, and we will take questions.
Alan, that was so fantastic. I really appreciate the tour you took us on of your experience and what you've done, what you're doing, and how that can benefit us all. I have a number of questions I wanted to get through, but first I just wanted to let folks know there's some information in the chat that Audrey was going to post, talking about the upcoming visit from Dr. Jeff Thompson, who was the CEO when Alan talked about this on May 16th. We are excited that St. Al's, St. Luke's, and the Idaho Clinicians for Climate and Health will be jointly hosting a symposium on climate change and health at St. Al's, and there's some information about registering for that. It will focus on both clinical and operational aspects of healthcare sustainability. So really something that I think can be beneficial to a lot of crowds. And then Alan was on Boise State Public Radio yesterday on the Idaho Matters program. We can post a link to that, as well as, one of the reasons I reconnected with Alan at St. Luke's is one of the organizations that reached out to him when he was at Gundersen to get some initial planning. Alan was on a podcast called Super Cool that has a little more detailed even story about Alan's journey. So we'll post a link to that conversation because it was really exciting and kind of got me re-inspired. So I'm going to try to amalgamate some of these questions to get through as many as I can. So first, you talked about how cutting waste really is step one. How do we achieve this? Is there a playbook out there that exists for healthcare organizations to follow?
Yes, there is. I talked about the organization called ASHE, American Society for Healthcare Engineers. That is a place that you can turn to, and they can provide you with some guidance. Also, Healthcare Without Harm has a group called Practice Green Health. They're probably not as strong in this area, but they do know some things, and they can help steer you towards what the right things to do are. I do offer this caution. There are these opportunities out there, but at the end of the day, we're healthcare, and we have to take care of patients. So doing some of these things, you need to make sure that you're doing them safely. But we've gone into healthcare systems. I don't know how many, 50 different buildings in healthcare systems, and found opportunities to save 15% just by changing the way they control their building. So those opportunities to reduce waste are there. You just have to be very careful to do it the right way.
One specific thing that is healthcare specific is the ability to provide backup energy generation on site. It's a mandate that we are able to power our buildings, I think, for 72 hours without being tied to the grid. And most healthcare systems deal with this by using diesel generators, which are cost inefficient and generate a lot of emissions on site. That, for us, those power surges that are going to cause problems are mostly during summer when the heat is bad and the smoke is bad, and adding to that with more diesel emissions is problematic. How is Gundersen providing that backup power? Are they still using diesel generators, or are they looked into alternatives for that backup energy power?
It's a great question. So when you talk about primary care, healthcare, hospitals where you have overnight stays, I2 type occupancies, the codes are pretty clear. You have to have emergency generation. It has to start in 10 seconds. And you need to do it for 72 hours. There are very few ways to do that other than having a diesel generator. Now, having said that, those are for hospitals that are larger than critical access hospitals. And it's so for critical access hospitals, CMS came out with a rule about a year ago that says if you are a microgrid, you can use the actual grid as a backup. So if you are providing power to yourself, then you can consider the grid to be a backup. Major healthcare systems or major hospitals can't do that. But also, if you are a clinic, you don't need to have that diesel generator backup system. So what Gundersen is doing, and we're helping them do this in a couple of different areas. Number one, we're creating a microgrid out of a medical campus. It doesn't have a hospital at the time, but we are using our renewable generation all to power the building directly. Some of this renewable generation was going back to the grid. We're using it on site all by itself, and then the grid will be our backup as we move forward. We're working with a couple of critical access hospitals where they're starting to generate their own power using renewable resources, and then saying, all right, we're going to use the grid as the backup. Now, they haven't got total approval yet to do that, but there are starting to become some paths forwards to do that. But when you talk about hospitals, I have not yet seen anybody not have an emergency generator for backup power. I know there's some folks out in California that are pretty progressive, and I still haven't seen them do that. But when you talk about clinics, there's lots of opportunities to do different things. In a lot of the clinics that Gundersen has, they use batteries for backup power. You don't need to have it for 72 hours. By the way, batteries are pretty expensive first cost, but the maintenance on batteries is pretty low. So it's a nice opportunity for backup power.
One of the things I think is interesting in hearing this conversation is all this talk about return on investment, time for payback. I don't feel like there is ever a payback for current fossil fuel-based processes, but these renewables provide essentially free energy at some point in time. When you're talking about these projects with hospital systems, is that something you're highlighting, or is that something that really turns the tide in convincing people that are paying the upfront costs to consider.
You're going to get me on my soapbox, Ethan. Sorry. Yeah, I mean, obviously, everything that we've done in healthcare on the sustainable energy side has been a positive payback, or we wouldn't have done it. I told you my mission was to come into healthcare and help reduce the costs. I can't live with myself if we come and do something that actually increases the cost. So, when we're designing new buildings, or when we did that at Gundersen, and we would say, here is if we went this way, if we put solar on the roof or put a geothermal system in, yeah, your upfront cost is going to be a little bit more. But here is how it pays back. Within 7 years, all of these things I'm talking about will have paid for themselves. And how long is this building going to be around? It's easy to say that building's going to be around for 50 years. I don't see many health systems that don't, or many health buildings that aren't around for 50 years. So if it pays back in 7 years, why wouldn't you do this? The other thing is we talk about, well, we need to put a carpet in this area. Well, all right, you tell me what the payback on that carpet is. How fast is that going to pay you back? Everything I'm talking about is going to pay you money. It's going to save you money in the long run. So, you put these steel boxes around your light switches that look pretty. Okay, tell me what the payback is on that. So those are easy conversations to have, because the stuff that we do does pay back.
Few questions about energy efficiency and energy consumption. Can you cite an example of how energy efficiency has positively impacted patient care in facilities you've worked in?
Yes, absolutely. So when we talk about energy conservation, we won't talk about renewables or any of that other stuff, although there are some things there. But when you talk about energy conservation and walking around and looking for opportunities to reduce energy waste, the other thing that happens when we've done this is we see things that aren't controlling very well inside the building at all. And by fixing that, not only will we save energy, but we will make it much more comfortable for staff and patients inside the facility, and easier for the facility team to maintain it. So when we do these types of things, we do see some benefits to patient care, to staff comfort, and to some other things. When you talk about insulation, in fact, I was just in a hospital here the other week where I went into the sterilizer room, and a nurse came up to me and said, "Hey, is it weird that the floor is hot in here?" And I looked at her and I laughed, and I said, "Yeah, that is pretty weird." But I was just down in the mechanical room that happens to be below that space, and that room was probably 100 degrees because they have so much waste going on and things are poorly insulated. So, there are these side benefits that happen when you start really figuring out how these buildings should be controlled.
How about some specific examples of that initial 15% of energy consumption reduction you talked about that doesn't require capital infusion? Can you give us a few examples of some of those projects?
Yeah, this one is pretty easy. So I talked about that supervisor I had that found that energy waste within 2 days. So that was an example of something that air handler was running all the time. It never slowed down, never turned down. And this is a building that was only occupied from, call it 7 in the morning till 5 at night, never occupied on the weekends. And this massive air handler was running all the time. So we said, all right, let's find a way to turn that thing off, or at least slow it down when people aren't in the building. And that itself, I think I talked about $20,000 a month. Just doing that was about $120,000 a year. It was that big of an area. Now I say this, but you got to do it. You have to be careful. You have to make sure that there's medical equipment that has to be cold. There are pressure relationships that you have to watch out for. So, these things are possible, but don't just go turn off an air handler. Make sure you're looking at the right things before you just go do that.
Time for one last question here. Who are the people that we should approach about starting some of this work? Who's the we in the work group you talked about at the beginning when you kind of were sitting down and looking at these big, hairy, audacious goals?
Oh, you mean internal to the health system?
Yep.
Yeah.
So like if I was going to go work with my health organization, or a colleague at a different healthcare organization in Idaho was going to say, hey, this is inspiring. I want to do this at my shop. Who do I need to go talk to?
I would say you need an internal advocate, and it sounds like this person may be the internal advocate. And then you absolutely need to talk. The CFO probably the key person to talk to. If the CFO isn't on board, it's very difficult to get traction to move forward with a lot of these things. Now, again, if they're not on board, you can turn them on board by talking about the margin improvement. I've never seen a CFO that didn't understand when you talk about margin improvement and making these changes. They see it and they say, "Oh, okay, yeah, that makes sense." But if you don't have that person on board, this is very difficult to get done. The CEO, obviously, if you can get her on board, that's a huge benefit as well. But the CFO is probably the more critical one.
Well, thank you so much for an outstanding talk, Alan. A lot to chew on there, and I hope there are a lot of operational leaders taking a listen to this and seeing how we can get involved, how Eneration can be a resource for us going forward as Gundersen helped St. Luke's get some of our initiatives off the ground. I will never drive by and drove by a methane flame today and never not think about how Gundersen turned that into power for their healthcare facility. And for my St. Al's colleagues, there's a Dairy Gold methane flame right next to your Boise hospital. So let's make it happen.
There you go.
Okay, well, thank you so much, Alan. Again, please take a look in the chat for some links to our upcoming Climate and Health Symposium. And we'll look forward to seeing everyone again in April to talk about climate impacts on farm workers in Idaho.
Right, thanks, everyone.
Thanks so much, Alan. That was great.
We done?
Yeah, I got to turn it off.